Well, good morning and welcome to Waco City Hall. We apologize for the delay. We've been dealing with a few technical issues and things. When you shift something a lot earlier than what you do, and we had a holiday yesterday, a lot of things have changed. I want to welcome you again to our weekly press conference. I'm Larry Holsey, Director of Municipal Information and Communications for the City of Waco, and I'd like to welcome our panelists today for his 36th consecutive, but sadly, his last press conference as mayor, Waco Mayor Kyle Deaver. We'll talk more about that in a minute because it's a sad day for all of us because you know the kind of job he's done for us on this particular deal. We also have Dr. Jackson Griggs with the Family Health Center, and we have Dr. Brian Becker, Chief Medical Officer for Ascension Providence. I welcome you all as always. Thank you for the early morning routine and allowing us city employees to have a holiday yesterday, which is the council did grant us. And downstairs in our studio, we're recording a complete voice track in Spanish, as well as providing the American Sign Language interpretation. Normally we have Hector Sabito, our city council member, to introduce and invite our Spanish-speaking audience to attend, to watch the video this afternoon at 4:30, but instead he was not able to be here, but we have our city secretary, Esmeralda Hudson, who's going to do so. Esmeralda, if you would, please
Sure.
invite our Spanish-speaking audience to tune in this afternoon at 4:30.
Thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en la canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. And that's all I had, Larry.
Thank you so much, Esmeralda. I do want to thank Ashley Nystrom, who is in control of our Zoom meeting today in our room, as well as Kelly Crane from our health district and Mark Randolph, who's in this large conference room. But here we are with our masks on, and we're doing and hopefully suggesting and recommending to you to do the same. The procedure we'll follow will be the same we've done for all 36 previous press conferences. We'll ask for each of our participants to make an opening comment. Then we'll open for the few questions that we've received during the week. And then we have two media representatives on the line, and we'll allow them at least two questions each. And then we'll allow Mayor Deaver to make some closing comments. So to get started, let's start off with, we'll go in the order of Dr. Griggs first, and then Dr. Becker, and then followed by Mayor Deaver. Jackson Griggs, Dr. Jackson Griggs from Family Health Center.
Thank you, Larry. Before I get started sharing the usual numbers, I just want to take a couple of minutes to acknowledge our mayor. I'm told that on the Osler teaching rounds at Hopkins Medical School, this elite group of House officers have on their tie the word equanimitas. The word equanimitas in Latin relates to the word equanimity in English. It is coolness under pressure. It is the ability to handle all kinds of stress and keep your head on your shoulders, to show wisdom and a clearness of thinking in a time of crisis. And I think that in a public health crisis like we have had in our community, it has given us all a sense of confidence and hope, a sense of perseverance that we have had Mayor Deaver at the helm of our city. And so not just for the years of 2012 through 2016, when Mayor Deaver served in the position of city council member, and not just the years of 2016 to 2020, when he has served in the mayoral position, but particularly during this health crisis, Mayor Deaver, I speak for myself. I would venture to say that I speak for the entire city to say thank you so very much from the bottom of my heart, from the bottom of all of our hearts. Your leadership through this has meant the world to our community, and there's no substitute for excellent leadership, and we all feel a deep debt of gratitude for your service as our mayor. Thank you.
Dr. Grigg, I'm before you go on, I've got to say I'm overwhelmed by that, and I can't tell you how much I appreciate the comments. But honestly, as you know, it's just been a huge team effort, and the work that has been done by you and Dr. Berner, Dr. Becker, Dr. Elias, and others that have been giving us good advice all along has been the key to making this work. And then the response from our community has just been remarkable. So thank you for those words. And I am very much looking forward to Dylan Meek taking over as mayor. And we'll talk about that a little more later, but I know that he is committed to working to keep our community safe while keeping our economy going to the extent that we can. But thank you for that, Dr. Griggs.
Yeah, absolutely. And it is like you to quickly deflect any praise or gratitude and redirect everyone's attention. But just for a moment, we'll just take the privilege of acknowledging just who you are and your character, integrity, and leadership. We are certainly looking forward to Mayor-elect Meek being our new mayor, but your contributions to this community have been just absolutely tremendous, and we will be forever in your debt.
Thank you.
Let me now share with you our usual numbers and then the slides that I typically share. Worldwide, there have been 52 million cases of the novel coronavirus and 1.3 million deaths. The United States continues to lead the world in new cases, with over 100,000 new cases per day for the last week, and in fact a little over that. 2 days ago, the 7-day average of new deaths per day in the United States crossed the threshold of 1,000. So 1,000 people dying each day in the United States of COVID-19. To date, the United States has a cumulative total of 10.4 million novel coronavirus cases. That equates to approximately 3% of the US population has now had a confirmed case of the novel coronavirus, and over 240,000 deaths from COVID-19. Shifting to state numbers, Texas has seen over 985,000 cases per the Department of State Health Services. Some news outlets are reporting that we've crossed the 1 million case mark. And we've seen 19,004 fatalities to date in our state due to COVID-19. The county statistics are, as of yesterday afternoon, the total number of confirmed cases, 11,625, 1,105 of which are currently active. As of yesterday afternoon, the Public Health District has received notification of 217 new cases of coronavirus. 78% of people hospitalized with COVID-19, and 12 of those patients hospitalized with COVID-19 are currently requiring ventilator support. There have been a total of 165 deaths in McLennan County due to COVID-19. There have been approximately 107,000 total tests performed in McLennan County, and around 93,000 have been residents of the county. Reporting on the community-wide surge testing, the total tests performed to date are 17,060. And among the surge testing, we've seen a positivity rate of 7.5%. Within elder care facilities in McLennan County, currently there are 13 current facility outbreaks. An outbreak is defined as one or more residents who have confirmed cases. There are 24 active cases in those facilities. In the jail, there is only one active case right now. There are currently 2 church clusters that are under investigation by the health district, 14 independent school districts, and 3 private schools are reporting cases on campus, and that accounts for 156 active cases within schools in the county. 110 of those cases are students, and 46 of those are staff. Now let me pivot to some slides to show you graphically our case count at the national level and on down to the local level. So here is the United States curve. These are new cases per 100,000 in population. This is a 7-day rolling average. And what you see here is that we've never been to this, we're in uncharted territory. We've never been at this level of new cases per 100,000 population in the United States. We're currently at 38 new cases per 100,000 in population across the United States. I'll show you Texas here. Texas is at 31. I continue to worry that this is potentially an undercount because of the state does not include antigen testing in their counts, so this may be artifactually low. And then McLennan County, this is a sobering line here, that McLennan County now has on rolling average 50 new cases per 100,000 in population. So like the country, our county is now in uncharted territory in terms of the volume of new cases per day per 100,000 in population. The implications of this are sobering. That one is that there are cases that are now so widespread that it is difficult to maintain contact tracing and adequate follow-up on that entire population. And in 3 weeks, 4 weeks, we anticipate that the death count will begin climbing in proportion to the way that we're seeing cases climb right now. While we are beginning to see some rise in hospital volumes, we are obviously very concerned about hospital volumes that are in the forthcoming weeks because of this currently exponential rise in new cases in our community. If you'll recall, I've been sharing the strata. This is Harvard Global Health Institute's categorization of community spread and so risk. Community spread category being from 1 to 10 new cases per 100,000, new cases per day per 100,000 in population. Accelerated spread being from 10 to 25, and then that tipping point being at 25. We have shared concern that we would reach that, and as you see, we have as we have crossed that threshold of 25 new cases per day per 100,000 in population, you can see the rapid climb in cases as we've hit exponential spread. Our positivity rate in the state is currently 10%, and in McLennan County, 12%. And you'll remember that there are two thresholds, one at the positivity rate of 10%. Keeping positivity rate less than 10% allows us to slow the spread or mitigate the spread of the infection, and less than 3% to really fully suppress the spread of infection. And we're far above that. I would also recognize that that positivity rate is in the setting of having free, easily accessible tests in multiple sites throughout the county with our surge testing. The effective reproduction rate for Texas is listed as 1.13. For McLennan County, 1.31. My sense is that these may be trailing a little bit. That if we were to seeing these numbers and seeing what's happening with the spread in our community, makes me wonder whether these statistics are as up to date as they are. They're as up to date as they're posting. I'm afraid that our effective reproduction rate might be actually functionally higher than what's listed here. I have two more slides to share with you. These are predictive slides from the Institute for Health Metrics and Evaluation. We've used IHME in previous conversations. It's an independent population health research center at University of Washington Medicine. And this, we were looking at new cases per day per 100,000, and this line graph shows daily deaths per 1 million in population. So what we're looking at is something different than cases. We're looking at deaths now, and right here that today mark is in November of 2020. And it shows that our daily deaths in the United States are over 1,000, as I communicated before, and that equates to 3 daily deaths per 1 million in population. So if you track that line graph, and we're trying to again here prognosticate, we're trying to foretell the future, and so there's some inaccuracies built into any model, but this is the sort of the best we have right now for anticipating what the future may hold. The way IHME put together this graphic and this predictive model, they suggested that at the threshold of 8 daily deaths per 1 million in population, so more than twice the daily deaths that we're seeing across the country right now, but at that threshold of 8 daily deaths per 1 million in population, if policy mandates are put into place that close educational facilities, that close non-essential businesses, where people are ordered to stay at home and large gatherings are banned, at 8 daily deaths per 1 million in population, then that the growth of daily deaths begins to level out. And while daily deaths still would be at twice what we're seeing right now, by February, it would still curtail further increase in the rate of daily deaths in the United States. If, though, those mandates are not put into place, daily deaths are sixfold what we're seeing right now by February. The daily deaths of 6,000 per day would make this far and away the number, by a large margin, the #1 cause of death in the United States. And And that's without any national or federal mandates to close businesses that are non-essential and to close educational facilities. If in addition to mandates, there's a close to 95% mask adherence in a community, then the death rate is further curtailed. And by February, we reach approximately the numbers that we're at right now. So I share this only as a sort of both from a policy standpoint and from just the anticipation of our death rate, what the experts at University of Washington are anticipating. In Texas, there are sort of a similar pattern where we see the death rate climb rapidly when no mandates are put into place. And with mask adherence and mandates, we see the daily death stay approximately what it is right now. So those are all the slides that I wanted to share with you, and that will also conclude my introductory remarks.
Okay, thank you, Dr. Griggs. That's amazing information, so fascinating, and we thank you so much for that. Let's go to Dr. Brian Becker, who is Chief Medical Officer for Ascension Providence. Dr. Becker?
Good morning, Larry. Thank you. I'd also take just a second to say thanks to Mayor Deaver. He has engaged our medical community from the outset, way back in February. He has sought guidance from leadership across our medical community. He has engaged both healthcare systems in this community, along with Family Health Center and others. And I just want to say thank you for your leadership through the pandemic to this point. It's been outstanding, and I look forward to working with Mayor-elect me as well. Again, I think it's always important to point out I'm here as a representative of Ascension Providence, and while we work closely with Baylor Scott and White Hillcrest, it's important to recognize that what I state and my opinions really reflective of our organization. So I don't want that to be carried over to believe I'm speaking for both organizations for sure. Flu, we certainly are early in the flu season, but I'm happy to report that we have seen fewer flu admissions this year than we saw last year. So we don't have a hospital full of flu patients who are requiring our care, and that's allowed us to focus attention and bed space and personnel on managing COVID. Certainly we have seen a steady increase in hospitalized patients over the last several weeks. And in our facility, we're in the mid 40s for numbers of hospitalized patients. As a percentage, I am happy to report that the percentage that are in our ICU are less than they have been previously. So while we have hospitalized patients, fewer of them are requiring critical care. That's certainly true today. That doesn't mean that holds true into the next week. So I think it's an important note today. The increased positivity rate that Dr. Griggs just spoke to is alarming. If we look back over the course of the pandemic, hospitalizations tend to trail that number by 1 to 2 weeks. And so when we see a big climb in the number of positive tests, it concerns me that over the next week or two, we'll begin to see more and more people that require hospitalization, intensive care services. So that is concerning to me for sure as we look at that. There are some things on the horizon that I'm sure both systems are exploring, as well as Family Health Center. But I can speak to our efforts. We are beginning to look at what does a vaccination plan look like, and how can we roll that out across our system, and how do we store that product? How do we administer that product? There's a lot of work going into what does that look like at the present time. And in the same vein, also some work on what does it look like to administer monoclonal antibodies. and how is that tool going to be used when we put that in our toolbox to manage COVID. So neither of those are here. They will be administered from the state, from our federal government to our states, and from our states on down to our local health departments. But I'm sure both health systems are working diligently to try to figure out what does that look like so that we can be on the front end of that and begin to provide those services to folks in our community as well. I always try to remind folks to get their flu vaccination. We're well into when we should have received those vaccines, but it's never too late. So I continue to encourage people to go get their flu vaccine. It's critically important this year for everyone to remember to do that. Also important for people not to ignore their chronic health conditions, whether those are physical or mental. Please continue to seek care from your providers. A lot of our providers in our community have transitioned to an ability to provide virtual care. So if you have concerns about presenting to an office and being exposed to potential coronavirus infection, please reach out. I'm sure there's an avenue that can be utilized to deliver care and service if you are concerned that that's an issue for you. So please don't ignore those matters. I look forward to questions. Thank you very much, Larry.
Thank you, Dr. Becker. Waco Mayor Kyle Deaver. Mayor Deaver.
Thank you, Larry. Thank you again, Dr. Griggs and Dr. Becker, for your kind remarks, and especially for being here and sharing your medical knowledge and wisdom with our Waco community. I want to thank all of you for joining us again today. We changed our press conference this week so our city employees could commemorate Veterans Day yesterday. Unfortunately, we were unable to hold our traditional Veterans Day parade due to the pandemic. But I do want to take this opportunity to thank all our veterans and their families for their service to our great nation and for the extraordinary sacrifices that these fine men and women have made to make our nation free and to keep it free. We must never forget their sacrifice. Turning now to our community's response to the coronavirus pandemic, let's begin with the data. And Esmeralda, if you could share the slides beginning with slide 1. All right, our cumulative cases passed 11,600 as of yesterday. And you can go ahead and move to slide 2. This next slide is a look at our new cases per day. The blue columns reflect the number of cases reported each day, while the red lines show the 7-day rolling average of new cases. Yesterday, Kelly Crane from the Health District said that we were again experiencing exponential growth in new cases, and I certainly agree with that assessment. We went from an average of 68 cases per day on October 28th to an average of 136 cases per day yesterday. That's a doubling of new cases per day in 2 weeks. And the peak average of number of new cases per day that we saw back in July was 155. Remember that we started at a much lower number of cases per day back in mid-June when our first episode of exponential growth began. So it's very concerning to see us now taking off and moving again in that direction. Dr. Griggs and others on this press conference, including myself, have been saying for weeks now that we have been near the tipping point where exponential growth could start if we're not careful. And it appears that a large number of people have not been careful enough, especially around the Halloween weekend. And now we are seeing that exponential growth as a result. Next slide, please. See, I'm having a hard time seeing that. Let's move on to the next slide, please, Esmeralda. This slide shows daily testing and positivity rates for the county since June 1st. Dr. Griggs referenced this. The blue columns represent the daily number of tests given, and the red line shows the 7-day average positivity rate. You would expect that positivity rate to be flat or declining based on the large number of tests that have been administered over the last 60 days with the free surge testing that's been given. Remember that the positivity rate is a fraction. The numerator is the number of positive results, and the denominator is the number of tests given. It is one measure of the prevalence of the disease in our community. The fact that we have a rapidly increasing positivity rate combined with an increasing level of testing is really alarming. Next slide, please. And as Dr. Griggs also mentioned, we've seen a dramatic increase in our hospitalizations over the past 2 weeks. The blue line on this chart is the number of hospitalized patients, and the orange line is the number of patients on ventilators. We had gone from the low 40s in hospitalized patients 2 weeks ago to 78 hospitalized patients today. Fortunately, patients requiring ventilators have not increased yet, but based on history, that is likely to follow. Remember that hospitalizations, ventilator use, and deaths are trailing indicators. Let's go to the next slide, please. We lost 8 more McLennan County residents to the virus this past week, and we've now lost a total of 165 of our friends and neighbors to this pandemic. If you can go ahead and take the slides down now, Esmeralda, that's good. Thank you very much. This is the situation that we've been warning about, and it is beginning to take shape again. It's happening across the nation, it's happening across our state, and it's happening here in our community. But we have a choice, and our behavior will influence how harshly we are affected as a community. You know, we are a country that believes strongly in our right to make our own decisions, and I certainly believe that too. But we must recognize that those decisions are not made in a vacuum, and they affect others. We know that we have a number of new cases that have been tied back to Halloween parties that were held at least one bar and at least one community center. These were large parties where people were not following the safety measures, and we now have a number of cases that have come from that. These are examples of decisions that can have disastrous effects on our community's health situation. They present the opportunity for vulnerable members of our community to become infected by the coronavirus and cause our hospitals to fill up with unnecessary cases. It's true that our hospitals have dramatically increased their ICU capacity since March. They have spent literally hundreds of thousands of dollars to do that. But that capacity is not unlimited. So please, as we are looking at upcoming Thanksgiving and Christmas holidays, let's be as careful as we can be so we can drive our new cases and hospitalizations down. There is exciting news about potential vaccines, but those vaccines are still many months from being available to the public. And we must all do our part to get through the time between now and then without causing more unnecessary cases, more unnecessary long-term disabilities, and unnecessary deaths. Larry, I'll turn it back to you for questions.
Okay, thank you. We only have 4 questions that were received prior to this, and then we do have 2 media representatives on the line. But the first question says, right now, Texas has more new cases per day than every state but Illinois. What are the chances of the state government issuing any travel restrictions?
Larry, I'll try to answer that. You know, clearly that is up to the governor. He has, as we've talked about many times before with Judge Felton being here, has taken control of the reopening, and he is sort of issuing any sort of restrictions. But I have to say that at this point, there is really no reason to think that our new cases are being caused by our residents traveling to other locations. This seems to be community spread now. And I think the more likely restrictions will come from other states, not allowing Texans to visit their states, as has been the case in the past.
Okay. On the whole, are people in McLennan County still complying with mask orders?
Dr. Griggs, do you have an opinion about that?
Yeah, and I'd like to give something more than just personal observations. I looked to see if there's any data that could help answer this question, and found that Carnegie Mellon University has a research group who is continuously running a survey on Facebook, and the survey poses the question whether individuals wear masks most or all the time in public. And in McLennan County, responses have shown that 82% respond affirmatively, respond yes, that most or all the time we wear masks in public, 82%, which sounds pretty good. I think that there are potentially 2 reasons why this might not square with what we're seeing in terms of our exponential rise in case counts. One is that on anonymous surveys, let me say even on anonymous surveys, individuals tend to answer things more positively than their actual behavior is when they know they should be doing something. So it could be that 82% is a little bit inflated. The other is that in public, that that may not be where the majority of the virus is spreading right now. In fact, I think that most individuals who go to the grocery store or go to Target or Walmart are indeed wearing masks. I think that by far more spread is occurring among friend groups and within extended families. I think that the evidence from our local health district bears that out, that the spread is not in large part among strangers, but it is in those circles where you feel familiarity and comfort with the individual, and that presumption of safety is why the individuals make the poor judgment of taking off the mask, of getting close together, and that's why the virus is spreading in those circles where individuals feel familiar with each other. So I think I would strongly caution our community at this moment in time. I would admonish our community. I would speak as emphatically as possible. Please, even in the most familiar circles outside of your immediate household, mask, keep 6 feet or more distance, don't cluster indoors. It's imperative that we stop the spread of this virus. Please remember that almost half of the spread of the virus occurs among asymptomatic individuals who don't know that they have the virus. So you feel great, but you're still potentially spraying that virus into the air and on those who you care about. Please mask. Please keep your distance. Please don't cluster inside.
Okay. How many calls about people not wearing masks in public, gathering in large groups, or otherwise breaking the rules does the Waco Police Department respond to weekly and daily?
Larry, I asked our staff to gather some statistics about this. In the month of October, the Waco Police Department responded to a total of 22 calls regarding people not wearing masks. This included 6 loud party calls where the complaints were that there were large gatherings where people weren't wearing masks. That's an average of about 5.5 calls a week. Last week, November 1st through 7th, Waco PD responded to 4 calls regarding people not wearing masks, with no reports in this month yet of loud parties and gatherings. Additionally, over the last 3 months, our code enforcement department has averaged about 33 mask complaints a month. They had 43 in August, 26 in September, 32 in October, and 16 in November. And those are all regarding business complaints. The Waco Police Department complaints are responding to homes and gatherings outside of businesses. And we do have a number of repeat offenders in the code enforcement group that code enforcement is having to respond to, I should say. And, I just urge people, if you are, as Judge Pelton has said many times, if you walk into a situation and you don't feel comfortable, you don't feel safe, just leave. And in addition to leaving, please let us know, because we have to address these things. Because as I said earlier, you have a choice. When your choice starts to affect others, then that's where we need to intervene to try to help that situation.
Okay, the final question I have is it recommended that we wear a mask when visiting outside with a friend while sitting at least 12 feet or more?
Dr. Becker, can you speak to that? I know that's a question that we kind of all have. How far apart is safe when you're outside?
Yeah, I'm happy to. So how far is far enough? I believe the literature out there is all over the place. So the 6 foot measurement that we're used to hearing is really about droplets. So those are bigger particles. And 6 feet is where that number comes from. Aerosolized, that Dr. Griggs has talked about a number of times. So much smaller particles that can tend to float and move through the air. Really depends on air movement and how big a space you're in, how big of a volume are you occupying with that aerosolized particle, and what's the amount of virus in that aerosolized particle. So I think this question is really a little bit difficult to answer. And if we say 12 is okay, is it 14? And I think you go back to what we do know, which is masks are not a substitute for social distancing. The measures that we talk about are additive. So 6 feet's good. Wearing a mask is good. Good hand hygiene is good. And all of those things together is better. So we should practice all of those things. I think it is really important that people recognize another point that Dr. Griggs has mentioned, and masks are for us to prevent spreading. But on the flip side of that, there has been some information out there, at least, that would support our wearing a mask could reduce the amount of viral particles that we breathe in. And there is supporting information, I believe, and at least some corollary information in other viruses that would support that a larger amount of virus that we take in leads to a more significant illness. So if I can limit the amount of particles I'm taking in, I may have an exposure and I may get sick, but maybe it won't be as bad. So at the end of the day, I think we should all do what we can. I should wear a mask to protect others in the community, and I should wear that mask all the time as best I can. I think we should wear a mask to protect ourselves. So if I can reduce the amount of virus that I take in if I'm exposed, maybe that'll lessen the severity of the illness if I get sick. So I do again encourage, as Jackson just did, wear your mask all the time as best you can. Socially distance, avoid large crowds, and practice hand hygiene. Stay home if you don't feel well. See your physician.
Okay, that's all the questions I have. Now I'm going to turn to the media. We do have 2 media representatives who followed our recommendations and suggestion and allowed them to register prior to 9 o'clock this morning, actually. They made the deadline. We have Rhiannon Saegert from the Waco Tribune-Herald, and we have Matt Gebhard from KCEN Channel 6. And let's go to Rhiannon first, and we're going to have 1 question each, and we'll maybe do 2 rounds here of questions. So, Rhiannon, what is your question?
Yes, I wanted to ask, as far as the percentage of hospital patients who are COVID patients, how close are we to having bars close again in this county or reduce capacity again?
So, Rhiannon, I think the latest number I saw, and Dr. Griggs, you may correct me if I'm wrong, was about 12.3%, 12.4%. It has been trending upwards, not continuously, but in a more or less continuous path. And the magic number there is 15%. And of course, that's the entire region, which is a 5 or 6 county region. Once it crosses 15%, the governor has said you must do these things, which include closing bars, reducing capacity to 50% in the number of businesses, including some manufacturing businesses. Obviously, we do not want our region to get to that point. And so that's just another reason for people to follow the advice that's been given. We know the things that we have to do to bring this illness back under control, and we simply have to do them.
Okay, thank you, Rhiannon. We'll be back to you in a minute. Matt Gebhard from KCEN Channel 6. Matt, we'll get you unmuted here. Shows he's muted.
I am now unmuted. Thank you.
There you go. Thank
you. Tarrant County's health department earlier this week attributed a lot of the positive cases in their schools to after-school sports. A source that we have in one of our local districts mentioned to me earlier this week that most of their cases are sports-related too. Is that something that the health department and city is seeing or noticing as well? And have there been discussions anymore about halting school sports in our county?
Dr. Griggs, you might speak to what you've seen or heard, and I can talk a little bit about the potential of stopping school sports.
I don't have specifics. I know that the health district has recognized that within schools that has been a particularly sort of high risk area, and that we've seen a number of cases within our school districts that have emerged from contact in team sports. I mentioned that last week, and again, I don't have details in terms of percentage, but it's a sizable enough percentage that this is something that the health district has been concerned about. In terms of regulations, I'd have to defer to the mayor or others who might know more.
Yeah, so I know that our health district is in regular contact with the various school districts to talk with them about situations that are occurring either on campus or off campus as extracurricular activities. And they're simply taking that on a case-by-case basis and consulting. I don't think that our health district or our health authority, Dr. Berner, has considered actually ordering that any sports activities be stopped at this point. And I think for the most part, these have been fairly small breakouts within the athletic departments, or potentially band or cheerleading, other types of activities. And so from what I have seen and understood, the school districts have been very responsive. They are just as concerned as the rest of us are about trying to keep their schools open and continuing to provide the best education that they can to their students. And so they are taking wise actions when it comes to having stopped some activities. And we've seen several teams have to cancel playoff games, for instance, and that's a big deal because then they're done, right? I mean, that's not just like canceling a regular season game. So I think you are seeing the school districts taking it seriously, and that's the way it should be. Those districts should govern themselves as long as that's practical.
Okay, thank you, Matt. We'll be back with you in a moment. Rhiannon, you have another question for us.
Yes. You mentioned that Halloween gatherings caused some outbreaks. Thanksgiving is right around the corner. Dr. Griggs, how should people handle this holiday?
The CDC now has guidance on holiday gatherings, and so first and foremost, I would suggest that anyone who is pondering how might we experience the Thanksgiving holidays in a way that's meaningful, first go to the CDC website. You could probably just Google Thanksgiving CDC, and it'll probably be your top hit there. Most important is to remember that virtual gatherings are the safest. If you can still derive some of the joy and tradition from your holiday virtually, then that would be my strong encouragement, particularly right now when spread is so aggressive, and it's occurring across the entire community. If an individual feels absolutely compelled to have an in-person gathering, then it's so important that every risk reduction measure is put into place, and there is careful, even fastidious dedication to those risk reduction measures. For example, keeping gatherings very, very small. And so obviously less than 10, smaller than that would be even better. Ensuring that those are only outside, which is challenging because when you have extended family over and they're meeting in your backyard, inevitably someone needs to go inside to use the facilities. And so you've got to have a plan for situations like that. There needs to be real leadership within any kind of gathering where someone has been very articulate about we must wear masks, we must protect each other. I think assuming that people are going to come and wear their masks might be folly. I think it's important that someone, whoever's hosting, makes sure that everyone who's attending stays in their mask 100% of the time. And and articulates the imperative of keeping distanced at least 6 feet. I think it's absolutely critical that those who are vulnerable to this infection, so aging adults, those with chronic conditions, avoid in-person get-togethers of any sort. Right now, the risk is just too great in our community, and so I would emphasize that, in particular, that group needs to consider virtual gatherings really the only smart option. Those are the things that immediately occur to me. Again, I would point out the CDC website is a good resource. And I might also ask if Dr. Becker has any additional thoughts, if anything's occurred to you, Dr. Becker.
No, I think looking at CDC website is always a wise choice, and typically in front of most large holidays or places or times where we might have gatherings. That's always a good source. And I'm listening to you, Dr. Griggs, and I'm thinking about my family, and I'm thinking about how hard that is to do. So I'm sure everyone else out there is doing the same, and trying to figure out how do we make that work? How does that look for us through Thanksgiving, Christmas, all really important family times. And I certainly empathize with our community as they try to navigate this. But your advice is rock solid. The fewer of those gatherings that we can have, the more we can figure out how to do it in an alternative way, the better we'll be in the months to come.
Okay, thank you. One last question from Matt Gebhard. Matt, are you on the line, and do you still have a question?
I am, and yes, I do. I'd like to go back to the schools for just one moment. In talking with employees at several different districts in the county, there seems to be a feeling that getting shut down is imminent. Is there a threshold for the county or health department or city to actually step in and force a school district to temporarily suspend in-person learning? And what would that threshold be? What would that process look like?
Well, that would be up to Dr. Farley Berner, who is our health authority for McLennan County. And what I have seen and what I have been told is that Dr. Berner is working on a case-by-case basis. There is no specific threshold because every district, every school campus is different. There are different age groups. There are all different considerations that must be taken into account. And I think Dr. Berner is sort of loath to take that action. He would prefer to work cooperatively with those school districts. And I don't think that he is on the verge of making any such move. But that would be a question that you would need to ask him specifically, because that is his authority and his right to make those decisions. He is a very bright, well-respected doctor in our community. He doesn't do things frivolously. And I have been with him when he has struggled to make very difficult decisions in the past. And I have been very impressed with the way that he has processed that information, done it based on science, knowing that there are impacts from closing schools that can be just as serious as the impacts of the virus. And so I think you need to ask Dr. Berner that question. But I must say that in my time working with him, I have been completely impressed and have full confidence in him to make those decisions as we go forward.
Okay, thank you all from the media. That concludes our media portion. And we're going to get into our wrap-up now. And Mayor Deaver is going to make his closing comments. And then we'll wrap this up, hopefully on time. Mayor Deaver.
All right. Thank you, Larry. And again, Dr. Griggs and Dr. Becker, thank you all for being here today. I really appreciate everyone who has participated in this in these press conferences over these last many months, including, of course, Judge Felton, who wasn't able to be here today, but has been here for the vast majority of these press conferences. His leadership of our county is outstanding, and many cities and counties have been at odds with each other across Texas as we've gone through this. That has not been the case here, and it has made our response so much more productive, and so I appreciate that very much. This will be my last press conference with you serving as mayor of Waco. Next Tuesday, we will swear in Dylan Meek as the new mayor along with Kelly Palmer and Josh Borderud as new city council members. And I could not be more optimistic about the future of Waco. Dylan will be an excellent mayor, and both Kelly and Josh will bring fresh perspectives and unique skill sets that I am confident will help Waco continue to grow and thrive. I am not going to take the time right now to go into detail with expressing my gratitude to those whom I will always be grateful for and indebted to for their support in our efforts right now. I'll save that for our final council meeting on Tuesday, but that list includes the panelists who are here today and who participated in this press conference, our great staff at the City of Waco, including Larry, you and your Municipal Information Office, and Esmeralda, you and the City Secretary's Office, and our great Waco-McLennan County Health District. We are so fortunate to have everybody that is working so hard to keep this county in good shape. We have fantastic staff, including our great city manager, Bradley Ford, doing a great job in his new role there. I will thank in more detail my fellow city council members. And of course, I can't leave that without thanking my family, my brother, who is my business partner, my law partner, who has been covering for me for the last 4.5 years, my parents, my children and their spouses, and my wife, Diane, who has been incredibly supportive through all of this. Dylan's going to do a great job going forward. He and I have talked extensively. I know that he will continue to follow the science and listen to the experts that we have at our health district, Dr. Berner and the hospital administrators and doctors, and that he will also, as I have tried to do, take into account the effects that his decisions and the decisions of the council have on our economy and other unintended consequences that we must think of. I just ask that you continue to take care of yourself, take care of one another. Please wear a mask and keep your distance, wash your hands, and do all the things that you know what to do. You know how to do these things, and if we just do them, we can drive this disease back down and continue to have a thriving economy and get to a place on the other side where we have a vaccine and we're just in a better place as a community, as a nation. We are getting through this together, and you and the city of Waco and our Central Texas community will continue to be in my thoughts and prayers. Thank you.
Mayor, thank you. And I certainly am not the most eloquent speaker when I get into things like this, and I know there will be future opportunities for those who would like to make those comments. But on behalf of all the people you just mentioned, a lot of the city staff, the health district, the EOC, the first responders, everybody who's worked on these press conferences, we could not have had a better, I guess if you would say it one thing positive about the COVID, it postponed the election and forced you to be mayor for another 6 months. So, and we're thankful for that you have done so graciously stepped forward and done that and made such a perfect spokesperson and with your sensitivity, as Dr. Griggs, Dr. Becker both have mentioned. So we are so grateful for that. And so we'll talk more about that before I start tearing up myself here. So, but I do want to encourage our viewers to know that this afternoon at 4:30 there will be a complete Spanish translated version of this airing on our channel, and then we will replay it live again, replay of it tonight at 7 o'clock on our channel. And those are just things that we hope that you'll share this, because this information is so vital, and we want to make sure that everybody in our community does that. You've heard the word flu shot mentioned. That's a very simple, easy thing to do. Let's continue to do that. And we're welcoming back now, as Mayor Deaver has just said, we're welcoming a former city council member who is now the mayor-elect, Dylan Meek, good, strong leader. We're looking for that, and we will have him here next week on Wednesday at 1:30 for our next press conference. Until then, have a good afternoon.